Hello, everybody. My name is Julie Friedman. I'm the director of the Irish Cantor-UCLA Women's Health Education and Research Center here at UCLA by offices in Westwood Village. And I am a CSUN MPH graduate from many, many decades ago. And I too was a student intern, a student looking for an internship. And I did my internship when I was an MPH student at the LA Free Clinic, which was a great introduction to working in community health, and that sort of set the trajectory for my career in really being committed to working in underserved communities. So I have with me today my two interns, one from UCLA and one MPH student. So Audree,
Audree,
why don't you introduce yourself?
Hello, I'm a fourth year UCLA student, and I'm a physiological sciences major and a food studies minor, and I just started working, interning here about 2 months ago.
And why don't you explain why you intern and what you do here?
Well, I want to be it's called a doctor in the future, and then I thought this would be a very good way to immerse myself in women's health. And here I've been able to edit a bunch of grants and help out whatever Julie needs, and just a bunch of different stuff.
So just before we started this video, Audree and I were on a conference call with a woman who is on a committee, a health committee that I run in the community. We're talking about purpose-built communities and how we can integrate financial health and health education. And so Audree had the opportunity to sit in and listen on that call. I try and involve interns whenever I'm on the phone to listen in, and they can just basically shadow me with whatever I do. Now, Nithershini, who is right here, she's going to talk a little bit about her internship. She has been with me since May or June. And Nithershini is an MPH student at Cal State Long Beach, and she's going to talk a little bit about, why don't you say how you got to Long Beach to begin with and what your past has been.
So I was a dentist back in India. I completed my undergrad in dental surgery, and I practiced there for a year, and I felt that I had a good taste about the clinical side of medicine, and I wanted to explore the non-clinical side, more into research and outreach. So I came here to the US to learn about public health, and I chose to do it under community health education. And I've completed my first year in Cal State Long Beach, and this is my second year. And we had to do internship, part of our curriculum, and I chose to do it at UCLA with Julie. And it's been a wonderful experience to learn so many different aspects on a non-clinical side. It's a wonderful experience to do research.
So why don't you talk a little bit about a few other things that you've done with me and that you've enjoyed doing?
So one of the interesting things that I've done after coming here was working on manuscripts, like publishing to research journals. Another thing is to work with grant proposals. Like we have been taught in class, but then when you do it on the field and work with community members and how they need different programs is kind of eye-opening when you have the hands-on experience over here.
So, not to put you on the spot, but my impression is a lot of when you are in graduate school and you learn a lot about theories and sort of best case scenarios and best practices of what is done, and your teachers try and emulate about how you should go into the community and work. And then when you get into here and you see the reality of don't have a lot of money, don't have staff, you are just trying to do everything you can with very limited resources. So I guess what I'm asking you is, when you see what the perfect world is, when you learn what you learned in school, and then you come to an internship and you see what the reality is, how is that different?
It's different in various aspects and in a very big degree, because when we read and when we learn how to plan a program or how to evaluate, it sounds very simple, but when you are in reality, it's not an easy world. Like, you plan different things, you calculated differently, but then there are a lot of external factors that play, and you see that it's very different, and then you learn how to cope up with the differences when your planning goes different. um, I think I'm just trying to say that you know what more you can do by just what you've learned inside class when you're working on the field.
So, as an undergraduate, Audrey, and you're thinking about going to medical school and you're graduating, do you think that has this given you like an eye-opening, like, gee, maybe I shouldn't go into medicine, or I really do want to go into medicine more, or I'm just trying, like, how does this square up with what you learned in school and what you're thinking of in the future?
Definitely drives me more to like helping people in underserved areas because it's such a like a problem. It's a but so yeah, it definitely makes me want to keep going in this route. And like eye opening in that like it's like worse than I thought, and to like have to keep working in order to like rectify like the issue and keep like just like help as many women as I can. And
So both Nithershini and Audrey and the other interns I have, they do a variety of things. Like one day they might be working on an Excel spreadsheet and trying to, delete the duplicates, or doing other, doing Xeroxing, doing mailings, things that are more administrative tasks that are really tedious and boring. And I guess I ask both of you that I don't want to exploit interns, but even, not to say that I'm this lofty director, but that I end up doing a lot of just administrative tasks because there's nobody else to do it. So if I'm collating and stapling, packets for an education program or whatever, I just, we need interns to do this, but I also want to like not glorify that all health education or health administration or whatever interns are going into is all that you just do program planning and you do evaluation research, that there's so many tasks that are rudimentary, and that's often I spend more time doing that than I actually do in the grand scheme of program planning. So I guess I ask both of you, like, how do you see that in terms of the big picture?
I would say that we provide a template or like a framework for other organizations to conduct a program, and we give them like every resources that they require it. And we might do a lot of administrative work, but I think every small skill that's being learned here has a good value and impact later.
Great. Well, let me just tell you a little bit about the behind the scenes work in terms of what I look for when I talk to prospective interns, starting from an email or a phone call and going. So when I either get a phone call or an email from a prospective intern, a lot of times they'll like spend a lot of time explaining, why they're interested in women's health and what they've done in the past. They'll send a cover letter, they'll do a resume, and I don't know if I'm different than other ones, but I just feel bad if people go into a lot of effort. I would rather somebody just be kind of like a short introduction. This is what I'm interested in. I'm available from this date to this date. I need to complete X number of hours in this period of time, and sort of the nuts and bolts of the practical aspect of your internship. Because then what I do is when I get somebody who's interested, I then have to go back and ask them, okay, well, when do you need to start and when do you need to end, and how many hours would you be doing a week? Because a lot of times that's how I first weed people out, is if they need to do it, in 6 months from now, or if they need to start tomorrow, then that helps me figure out if I can accommodate their schedule or not. I get way more requests for interns, both undergraduates and graduate students, than I can take. Last summer, I had 3 MPH students, 2 from USC and 1 Nithershini, who was with me in the summer, from Cal State Long Beach. I had additional interns that wanted to work with me, and I really didn't even want to take 3. I really only wanted to take 1, and then I got stretched to take 2, and then I took 3, just because the time worked out. All 3 of them only overlapped for a shorter period of time, so there was a space issue. But going back to that, I think that if you give that information up front, it makes it a lot easier, because then if I have to go back and forth a million times between somebody who's interested in interning, I can eliminate them so quickly, because I have more requests than I can take. That's just one thing that would make my life easier if I knew up front. The other thing is that I think that if interns kind of spark my interest when they send an email or say something over the phone of some unique skill set that they have. They can say, I'm bilingual, or I have a lot of experience working in cross-cultural health issues, or I've worked at the YWCA or a Boys and Girls Club, and I've worked with a lot of community groups. So I'm not necessarily looking for somebody that has health experience, because I know that as a student, most people don't have that experience. I'm looking for some skill that's transferable. So if you worked in retail, if you worked in a fast food restaurant, or if you worked at something that you can use that skill of being accountable for your time, customer service, something that you can bring to the table, that is very attractive to me. I would say that I've had some interns or prospective interns who've emailed me or talked to me on the phone, and they've said, oh, I want to do this internship because then I'm going to go to medical school, or I'm going to go, get my PhD or something else. And they do it in a way that is sort of, this is just kind of like I'm fulfilling a requirement that I have to do these hours. That is a little bit of a turnoff. And I know they have to do the hours, but if they say I need to do the hours, but I'm really interested in gaining experience in grant writing, or gaining experience in community mobilization, or I really want to work on a manuscript and possibly get my name on a publication. Like, if people are upfront about what they want besides their hours, that I try to kind of look at that. What can I give them? If they want their name on a manuscript, am I working on a manuscript that I would need their help in during this time period? So I think that those things, as much upfront and as much transparency and honesty, that is very desirable. I would say that don't apologize for not having health experience. Don't apologize for not having good grades. Don't apologize for being the first in your family to go to college. I think that a lot of times students feel that they are less than because of some sort of stumble or income or other issue that they've had, and that they think that that's going to be like a point against them. I don't look at that as a negative. I look at that as a positive if it is framed in the context of how that experience can propel you to do a good job as an intern. What makes you distinct from somebody else? So I've had, especially in the spring, I get a lot of intern requests from people out of state who are coming home, who are doing, going to MPH program and coming home and living in LA, and they want to get their hours done in the summer. So I've had students from, Michigan, University of Michigan, and other public health schools that have said that that they have an articulation agreement with other schools. I've had students from Drexel, their MPH program, and I haven't taken them necessarily, partially because of the timing issue. So I would say that the timing is a big part of what I look for. I would also say that even if you are desperate and you just need to find an internship, try not to show it. I know that's hard to say, but when I've had interns who say, I got to finish my hours, and I don't have transportation, and I'm a UCLA student, and I need to finish this, and are sort of has this desperate mentality, that I just don't buy into that. I don't want to have somebody that just needs to kind of go through the motions. So I would say, even if you are desperate, don't show that to a prospective internship preceptor. So I would just say plan early. It takes a long time for me. It's not just me that has to accept you. There's a lot of bureaucratic behind the scenes stuff that I have to do both with CSUN and with UCLA to accept students. So don't plan at the last minute. That is going to not work. Even if you have all the credentials of I love you and I want you to work with me, the timing is such that I can't always accommodate people's schedules. So if you plan ahead and you say, this is my window of time, then I might be more accommodating. Just to back up a little bit, the Women's Health Education and Resource Center, we have 3 programs that we involve interns in. One is on reproductive health and the environment. We do an annual conference, and I've had interns, one of my USC interns last summer, basically orchestrated all of the speakers. We had like 18 different speakers on 3 different panels, breakout workshops, and basically that was what that intern ended up doing. We have a program on lesbian and bisexual women's health. Nithershini, who you met earlier, is one of my Long Beach interns, and I have another Long Beach intern, MPH student, who's working with me now. She's helping plan that conference. Here it is November. She's planning that conference for March, and so we're getting going on that right now. And then another program is our Women's Health and Money at Work program, which is integrating health education and financial literacy. And that is a moving target with a variety of facilitators and locations that we provide the program to. And that is another organization or another program that I involve interns with. So I try and give interns like a project that they are mostly responsible for, but they basically are involved in a variety of issues that that our center is involved with. We are funded by grants. We're funded by our executive advisory board that has to give funding to our center. We don't get funding from the university, so my salary is partially covered by grant funds, as well as our executive advisory board members who are obligated to be on the board because they give a certain amount of money every year. So that's basically my overview of our internship program. If any of you are interested, I'm always open to talking to people and considering interns in the future. And so I hope that you got some insight from this. And I think it's always good to cast the net wide where you're thinking of interning. So good luck to all of you. Thank you.